The Heart and Lung Institute at Community is a system-wide approach to cardiac care that allows patients access to specialized heart care at all hospitals across the community health system. This week, we're taking a closer look at some of these services and the team members that care for the Valley patients with all of their hearts. For patients needing complex cardiac care, having access to comprehensive services and advanced technology is important.
We have a wide range of departments. We have our cardiothoracic OR, we have our cardiac cath labs, we have our cardiology departments, as well as our inpatient rooms, and we also have some of our specialty clinics like LVAD and structural heart.
Laurie Biggs oversees outpatient cardiac services at Community and says patients now have more access to heart care thanks to the Heart and Lung Institute.
With the Heart and Lung Institute expansion, we have had the ability now to expand all of those services out to all 3 campuses.
Advanced cardiac procedures that were once only offered at Community Regional and Fresno Heart and Surgical Hospital are now being offered at Clovis Community Medical Center.
We have 2 new ORs just for them, a hybrid room, and then we also have a completely new ICU just for heart patients.
Keilani Amos works in cardiovascular surgery at Clovis Community, helping patients who need to undergo procedures of the heart and lungs.
So we do root replacements, aortic dissections, windows, and then for our lungs, we usually do that minimally invasive. We'll do like a VATS procedure. That's where we go in with scopes. We'll go inside, we'll look at the lungs, sometimes we'll clean it out, sometimes we'll take out the lobes.
Because cardiac care can be complex, teams across the health system work together to provide the best possible care to every patient.
The nurses that have come through here really put in a lot of effort because we have to know a lot of different procedures and complications that come from it.
Cardiovascular nurse Erin Dodd works in the Cardiac Progressive Care Unit at Fresno Heart and Surgical, helping patients with complex conditions transitioning out of critical care.
We work with our cath lab as well as our cardiac surgeons. We range from placing heart stents to heart devices like the Watchman device or mitral clips to open heart surgery.
And it takes a patient-centered approach from a team of cardiologists, cardiac surgeons, and cardiac nurses to make it all possible.
I love the nurses that we have here at community medical centers. They are some of the smartest and talented nurses that I've ever seen.
Amanda Davis is Community Regional's LVAD program coordinator, helping patients battling severe heart failure.
I just really wanted to be a part of something that could bring cardiac care to the Valley and just help grow it in a way that when somebody else's family member needs that, we're here. We can do it here.
The staff have been, they're motivational, honestly. They're more than dedicated. They are passionate. They train all the same. So regardless of what facility you go to, your nurses have all been trained to the same standard.